Welcome to Voices for a Healthy Legacy, where we have discussions about health and wellness with relatable medical professionals in an effort to improve generational health outcomes. I am your host, Dr. Andrea, a board certified family medicine physician, and today's guest is Dr. Jimel. Welcome to the show, Dr. Jimel Gibbs.
Hey,
Welcome to the
thank
show.
you. Thank you for having me. I do
Yes,
believe that I might be your first nurse practitioner. So,
yes,
so
yes.
kudos to you for giving us a platform. I'm honored that I am the very first nurse practitioner to be featured, hopefully not the last.
Yeah, oh, definitely not the last, not the last. And so just tell us a little bit about you and then we'll get into, because people say nurse practitioner, but she called her a doctor. Like, what does that mean? So we'll get into a little bit of that because even though it's not new, it's a newer
Mhm.
program that a lot of people may not be aware of. So just kind of start out by just telling us a little bit about who you are.
Well, thank you. So I am Jimel Gibbs, born and raised right here in Birmingham, Alabama, and proud of it. I attended the University of Alabama, which is in Tuscaloosa, prior to what many people think. A lot of people think that it's in Birmingham. It's not in Birmingham, it's in Tuscaloosa. So after I graduated, I remained here in the Birmingham area where I met my husband.
Okay.
My husband, Mario Gibbs, of 16 years. God has blessed us with three amazing children. So I am a wife, I am a mother, I am a daughter, I'm a sister, and I am a nurse practitioner. So I am thankful, I'm very grateful for every opportunity that the Lord has provided me to function in those roles.
Awesome, awesome, awesome. So, what inspired you to go into the nursing field? Because a lot of people try to figure out where they fit in the healthcare space if they want to go into healthcare. So, what inspired you to go into nursing specifically?
So I feel that originally I was inspired by my mom and my aunt. My maternal grandmother was diagnosed when I was a very young child with a very rare neurodegenerative disorder called progressive supranuclear palsy, which most
Mm,
people have never heard of, but it is very similar to Parkinson's disease.
okay.
And so that was just very, very tough for my family. But I watched my mom and I watched my aunt just care for my grandmother with so much love and so much gentleness and so much patience. And I think it just inspired me to want to be a caregiver to people with chronic illnesses and just to do that in the most respectful and the most patient and the most kind way. So that is what inspired me to want to join the career in the field of nursing, even as a young child.
Okay. So it was kind of, you knew that from kind of an early age that you wanted to kind of jump in there and be one of the people to just kind of help be a part of the healthcare team to make sure that people like your grandmother was taken care of.
Absolutely.
Okay.
Absolutely.
So take us down your journey. So RN to nurse practitioner and then DNP. So tell us about that journey and what made you go in that direction once you were in the nursing field.
So once I was in the nursing field, I just admired the autonomy that nurse practitioners are able to operate. And so even as a registered nurse, I decided to go back for some additional training. And I was fortunate enough to be able to do my clinical rotations with some of the best, most renowned physicians here in Birmingham, Alabama. Dr. Nova Law.
Oh, yeah.
Shout out to Dr. Law and also Dr. Robert Kane. So they taught me so much, even as a nurse practitioner student, and they were physicians, but they really taught me the importance of assessment skills and how critical that is to what we do in primary care. So from there, I've just grown. And as you said, I did go back and get my DNP, which is my Doctor of Nursing Practice. When I am in the clinical arena, I do like to distinguish. Most of the time, I don't refer to myself as Dr. Jimel Gibbs because even though physicians and nurse practitioners, we understand the difference. I never like to insinuate that I'm a physician. I am not. I'm a nurse practitioner, and I don't like to confuse patients. And I like
Mm-hmm.
for them to understand the difference. I never try to present myself as being a physician. So a lot of times I just refer to myself as Jimel. I want them to have a really good relationship with me. I want them to feel comfortable with me. And sometimes they may refer to me, as Dr. Jimel, which is fine. But I clearly make the distinction and let them know I am a nurse practitioner. So,
Okay.
yeah.
All right. And for the people who may not know, having a doctorate in the nursing field, what doors does it open up for you to have by pursuing that degree?
So I think that it really shows my commitment to my career, to my field, my passion. I hope that that's what it shows. My commitment and my passion for what I do. I love what I do. I'm very proud of what I do. I'm proud of my background as a nurse. I feel like it just opens the doors for me. It gives me opportunities to be able to go and speak in various ways, various platforms, such as the one that I am utilizing here with you today. I love to be able to tell people what I do. I love to be able to mentor students. I mentor registered nurse students, RN students, as well as nurse practitioner students. So I
Mm-hmm.
feel like it just allows me so much more opportunity knowing that I have gone as far as there is to go in my career. So, and
Right.
hopefully, like I said, being a mentor, hopefully that's inspirational or inspiring to others. And they say, hey, if she did it, hey, maybe I can do that too.
Right. Absolutely. Absolutely. And you have a teaching. I know you said you kind of mentor and things like that, but you've
Mhm.
actually done some teaching on
Mhm.
the nurse level as well. So tell us a little bit about that because a lot of people, they know about the nurses that may be in the hospital, in the clinic, in the nursing
Mhm.
homes, but you also have done some teaching. So
Mhm.
tell us about that.
Yes, I've been able to teach. I've been able to teach clinicals. I've been able to teach in the classroom. I've taught RN students, and I really enjoyed that. But I found that when I did that, I personally prefer the clinical practice more.
Okay.
So, what I do now, and I'm going to talk more about my consulting and renewed focus and what that is, but renewed focus, which is my consulting firm that I recently started about a year ago, it allows me to continue to provide education and I continue to teach, but it's on a different platform. So, no, it's not specifically for college or for university, but it does allow me to get out there into the community, educate holistic health, mental health, physical health and wellness, and emotional health and wellness, social health and wellness. So, it allows me to teach, but just on a different level and in a different platform.
Gotcha. So I know you've done some family medicine as well as some mental health. Is now most
Mhm.
of your focus on the mental health, or do you do a little bit of both? And what made you decide on that?
I currently do a little bit of both. I like doing a little bit of both. I like kind of being able to address, if I have a mental health patient and they want to talk about blood pressure, I want
Right.
to be able to remain in the element where I can speak to both. I noticed that in my primary practice, I started out as a family nurse practitioner. That is my foundation, that's my base. But a large number of the patient population were suffering with comorbid major depressive disorders, as well as many varying anxiety disorders,
Mm-hmm.
generalized anxiety disorders, post traumatic stress disorders, social anxiety disorders. So I felt that it would be best to go back and get that additional psychiatric mental health and nurse practitioner certification in order to better serve my patients. And
Right.
it's been a wonderful experience. So currently, yes, I do a little bit with both, just to kind of stay in the know because of course medications and different things are always changing and I like to stay abreast with both.
Right. And you really can't separate the mind from the body because one can definitely affect the other. So, will you talk a little bit about what you've seen with your practice where, like you said, you have the mental health portion of it, but then you have the blood pressure? And have you seen like any correlation, like if you kind of get one under control, it positively impacts the other?
Absolutely. So I think that a lot of times people suffer from mood disorders, such as major depressive disorders, and they really have no idea. We
Mm-hmm.
have patients come in and they'll say, "Hey, I'm not sleeping well. I have no motivation. I have no energy. I'm fatigued." They'll name a lot of symptoms and they won't even realize that it's depression. So a lot of times depression may manifest as some type of chronic pain. Oftentimes, if patients have been diagnosed, if they've had a stroke, if they've had a MI, if different types of disease processes will cause them to have depression as well. So what we found that is when we can adequately address that depression, when we can diagnose it, when we can treat it, they have better outcomes as far as their overall prognosis, even with
Right.
those physical and somatic disorders and disease processes. So we
Mm-hmm.
have to be able to address not just the mental or not just the physical. Like you
Right.
said, we've got to address the mental, the physical, social, emotional. It's all about holistic health and wellness.
Right, right, 100%. Because I know I've seen people say, well, I just need to fix this one little area and then everything will be fine. And it's like, well, maybe, but not necessarily. Because when you start looking at the whole patient, the social aspect, the
Right.
emotional aspect, the physical, the environment, when you start looking at all of those things, it can impact your overall health. So I think it's really good that you not only address some of those physical ailments, but you thought enough about mental health to stop and get some additional training just to make
Mhm.
sure, not that you don't get the training in family medicine.
Right.
Many times they can't get in with their
Mhm.
psychiatrist,
Absolutely. Yes.
So a lot of times, it ends up being on that family level, family medicine level anyway. So the fact that you got that training is awesome. So let's say you've got a patient and you're dealing with the physical side, and then you kind of get a sense that there may be some type of mental health component or mood issue that's going on that they may not necessarily want to say. How do you build that trust, or what are some tips for patients who are like, well, I kind of want to say something, but I really don't know how to bring it up. I don't know if I can trust
Mhm.
them with this particular part of my life. I'm okay with the high blood
Right.
pressure, diabetes, those
Mhm.
types of things. But for some people, that's kind of a sacred space when you start
Right.
talking about mental health. So, what are your thoughts on that?
So you're absolutely right. Oftentimes, people will suffer with mental health conditions and mental health disorders, and it's something that they're just really embarrassed about. They don't want to admit that they have depression. They don't want to admit that they have anxiety. And unfortunately, I do not know why, but it hits us in minority communities, Hispanic communities, African American communities. Oftentimes, we just don't want to have to be on an antidepressant. We don't want to have to admit that we benefited from therapy. So, because of that, we want to always assess every patient, really, not just women, not just men, not just blacks, not just whites. We want to assess every patient. And that's often done, like you said, even in the primary care office. So there's a tool that we like to use. There's a scale. It is called the Patient Health Questionnaire. It's the PHQ-9. So it's about
Mm-hmm.
9 questions. And it asks patients in a roundabout way. Oftentimes they really don't even know why we're asking these questions, but it is assessing them to see if depression or major depressive disorder is a problem with them.
Right.
So when you talked about building trust, I think that once I do establish that depression is a major problem for patients, I believe in being open and being honest, and I will talk to them about being on the antidepressant medication, such as an SSRI. And I just like to get their feedback. And I believe as a provider, if we're honest with our patients, now we're living in the world of Google. So if you don't prepare your patients for what to expect with their disease process or with their medication or with their side effects, they're going to Google it.
Oh, for sure. And they're
If
going to
they
let you
Google
know
it,
that they Google. And
they're going
Google
to
did
let you
not
know
say
that.
this.
Absolutely. And if it's something you haven't prepared them for it, more than likely, they're probably not going to be compliant. So, with a lot of the medications that we deal with, SSRIs in the psych world, some of these medications may cause weight gain. So that's not something, I'm not going to hold that information back from my patients. I'm going to prompt them and say, hey, we're going to start this medication, but I need you to know, if you're already dealing with weight issues, this may cause you to put on a few extra pounds. You may want to really work on your diet. You may want to really work on a routine exercise program, which is going to benefit them anyway if they're
Right.
already having depression. But I do prefer them to hear that from me.
Mm-hmm.
Whether rather than Dr. Google.
Right.
And so I feel like it just helps to establish that trust and a very healthy rapport with my patients, with the men or even with the women. Some of the medications decrease libido. Hey, I want to let you know from the start, this is something that you may notice.
Right.
So I believe just being open and honest about what to expect really helps to build trust.
Great, great. Now, some people will say, well, hey, I don't know if I'm at a point where I want to take medication for some type of mental issue that I'm dealing with. And I love the fact that you are very open and honest with them about the potential side effects and what could possibly happen, even though it may not. But how do you, some people, even knowing all of that, you being honest, they're still very hesitant. And I know there's a stigma with being on medicine. Even sometimes if they've seen that it worked really well for somebody else, they are still really hesitant, like, well, I don't know, I don't want to be labeled. How do you coach some of your patients into trying it, especially because honestly, some people don't need the medicine, but some people need it, even if for a short period of time,
Absolutely.
especially if they are going through a rough patch, whatever that
Mhm.
is. And it may be something you would say, hey, well, let's try this for this particular time. How do you get patients to at least try it and say, hey, we may not need it forever, but let's
Mhm.
use it as a tool? Because I try to tell them, this is just one of the things. So what are some of the things that you talk about? Because I've seen where the ones who really need it, it changes their life. So
Mhm.
so kind of talk
Absolutely.
about that.
Absolutely. Well, actually, I do what you just said. A lot of patients believe that if they start this medication, whether it's a antidepressant or anxiolytic, hey, I'm going to be on this medication for the rest of my life. I don't want to be on another pill for the rest of my
Mm-hmm.
life. And I tell them that is absolutely not true. Like you said, someone may be going through a rough patch. It may be grief. Maybe they lost a loved one. Maybe it's a divorce. There are so many things that people go through in life, and they just need something to help them cope, something through the grief period.
Right.
Sometimes that may be medication, sometimes that may be therapy. But I tell them it's really like being on a blood pressure medication.
Mm-hmm.
You can be on a blood pressure medication, and with healthy lifestyles, diet, exercise, weight loss, oftentimes people are able to either discontinue the blood pressure medication or at least
Mm-hmm.
taper off of it. And so it's the same thing with being on antidepressants. It does not mean you're going to be on it for the rest of your life. It may just be for a few months. You may
Mm-hmm.
only need it for about 6 months. You may only need it for a year. But let's go ahead and address how critical and important this is to your quality of life. If you can't
Absolutely.
get out of the bed, if you can't go to work in the morning, if you are not participating in activities and things that you loved, and now you don't want to participate, you don't want to do it, you have no interest. Well, we need to get you to a better quality of life. And if being
Mm-hmm.
on this medication for a few months is going to get you there, let's talk about it. Let's do that.
Right. Right. It's totally worth it because, and I've seen where some patients have been in a low place for so long that it's kind of
Mhm.
like a reset. Like that's their new normal per se,
Right, right.
and they're like, well, I don't really think I'm depressed because I just feel like I normally feel. And then,
Mhm.
once you start asking them some of those questions, they're like, well, wait a minute. If they've been in that place for so long, sometimes they may not even
Very true.
realize it. Have you seen that?
Absolutely. Absolutely. I think it's just important to just educate patients and say, hey, that's depression. you not being able to get out of bed, either be weight loss, weight gain, and even it may manifest in your sleep patterns. It may be insomnia. It may be sleeping all the time. But when you
Mm-hmm.
notice that these things are changing, your mood is changing, sometimes it's your concentration. You can't focus, you can't concentrate. All of these are symptoms of depression that a lot of people, like you said, they miss and they don't even realize that they're functioning in major depressive disorder. So it's about educating them, it's about encouraging them, motivating them to find something that you want, whether it's your child, whether it's your grandchildren. Find something that motivates you to want to get back to being yourself, to want to get back to that happy place, that quality of life that you previously enjoyed. Let's get you back there. So,
Right,
yeah.
right. Because we want you to feel good. We don't want you walking around not enjoying the things.
Absolutely.
We know life hits us. We may lose someone that's very close to us, and you're like, "Well, I don't feel my bubbly self." And so some of those
Right.
things are expected. You mentioned grief before, but so at what point should someone get concerned? Let's say if they're noticing a change and they feel like they're kind of staying there for a while in that low place or in that place that's just kind of not where they're used to being. At what point should they get concerned enough to mention it to you? Or I don't want to say just mention it to you, because some people say, well, I've been this way for a couple of days. Then you have some people who say, I've been feeling this way a couple of months, a couple of years, a couple of decades. You know what I mean? So,
Mhm.
how do you kind of address that, the time frame?
I do like to know how long the symptoms have been going on. Some people may say, oh, it's been going on about 30 days. Some people may say, hey, it's been going on for about 3 months.
Mm,
So when we get into those longer periods, it's definitely time to address it. And again, I just like to let people know, hey, let's get through this rough patch.
right.
Let's because oftentimes when we're dealing with major depressive disorder, sometimes it is temporary. Sometimes we're dealing with real imbalances. The
Mm-hmm.
neurotransmitters in our brain are imbalanced and they require medication in order to get back in balance, whether it's serotonin, whether it's dopamine. So sometimes patients are just going to benefit. And I say, let's try it. Let's
Right.
try it, let's for a couple of months and let's just see if it makes a difference.
Right.
So it's just a conversation, and sometimes you don't always win them, you don't convince them during that first visit. It takes you to kind of tackle and have that conversation every single time. And if that means that you're bringing them in every couple of weeks, every few weeks to assess them and reevaluate, let's do that. Let's really try to highly encourage them to implement these changes in order to get to a better place. Because you can't just think about yourself. You've got to also think about your family, your spouse, your children.
Mm-hmm.
You've got to be motivated to do it for them, even if you're not motivated enough to do it for yourself.
Right. And some people, they will say, well, I still don't want the medicine, but I'll go to therapy. So, which is fine, because the goal is to get you better. And sometimes we need both. We need
Mhm.
therapy and medication. So if some people aren't willing to do medication, do you recommend them doing some type of therapy if they're open? And I also want to say, we don't just push medicine. We may recommend it where it's appropriate. And
Mhm.
also, it's all about the communication between whether it's the nurse practitioner, physician assistant, the doctor, whoever. The more pieces of the puzzle that we have, the more information that you give us, we can kind of determine what's the appropriate route to be able to serve you the best. How do you kind of coach them with the therapy route?
Personally, I believe that therapy is beneficial, like you said, whether you accept the antidepressant or the antipsychotic or not. Therapy is beneficial. It's beneficial for mild depression, moderate depression, major depression, because therapy kind of helps us to address those negative behaviors, those negative thought processes. It teaches effective coping skills. Sometimes
Mm-hmm.
you got to get to the root cause. What is causing this depression? What is
Right.
causing this anxiety? It may be from a traumatic event that the patient doesn't want to talk about or relive, or talk about that experience. It may be something from their childhood, but therapy kind of helps to kind of dig in and kind of get to the root cause of what is going on. So therapy, I feel, is extremely beneficial. And I like to encourage people now, you can do it virtually. If you don't
Right.
want to go and as they say, sit on the couch, sit on the little couch, you can do it from home. There's
Right.
most counselors and therapists, they offer virtual sessions, they offer in-person, live sessions. Some people say, hey, I don't want to do it with someone here in Birmingham. I'd rather do it with someone in Georgia, or
Right.
and that's an option, and you can
Yes.
absolutely do that. Now we have access to so much. Technology
Mm-hmm.
allows us. There are even apps that you can
Right.
download on your phone, and
Right.
and they can help you. Set it up with a therapist. Oftentimes it's covered by insurance, so I tell patients, why not take advantage of that? There's so many different resources. Oftentimes employers will also help, and they may pay for you to go to therapy. So take advantage of that. Yes.
Right, right. What about sometimes there are community resources out there where I don't necessarily know all the specifics, but sometimes they will have so many therapy sessions that they may offer a month.
Mhm.
Or they may have group sessions where someone may come and speak, like yourself, on various mental health topic, and then people may be able to ask questions. So even though that's not your therapy session, you're still getting the information and you are still able to ask a professional some questions
Mhm.
within, of course we have to have boundaries because, for legal reasons, you can't just openly just kind of have an open therapy session, but people can ask questions. So what about some of the community resources that are out there?
So, yeah, I like to encourage people to utilize support groups. So, oftentimes, a lot of the libraries, a lot of the churches within the community, they do have support groups set up. They have support groups for people who maybe lost a spouse, they have support groups for caregivers who are dealing with caring for their loved one with dementia. There's so many different types of support groups that are out there. So I encourage, people, hey, if you don't decide to do therapy, let's utilize a support group. Let's,
Mm-hmm.
get a buddy. But there are so many different resources that are out there. And I think that, again, with technology, I've had patients that say, hey, I've got a Facebook group.
Okay.
This Facebook group, they're with me and they're caring for, some a loved one with Parkinson's, or their
Right.
child has cancer, or so it's good to find something that's going to speak to, those emotional needs of a
Mm-hmm.
person. And sometimes that may or may not be family. So yeah, so I just like to encourage different outlets, because everyone's not going to want to do medication. Everyone's not going to want to do therapy. But let's
Right.
try to figure out what works for that individual.
Right. And a lot of times people feel alone, when
Mhm.
they don't reach out to you, or if they don't reach out to someone in the community, or they don't seek out different resources. They feel like they are the only one. I'm the only
Mhm.
one in the world who may be going through XYZ. Nobody understands, and nobody will be able to help me with my particular situation. Do you still see value? And I already know what your answer is going to be. Do you still see value in at least, being a part of those webinars or being a part of those support groups? What are your thoughts on that for the person who feels like, nobody gets me and what I'm going through?
So absolutely. And what I like to encourage, it may be a situation that I can't speak to. Sometimes I can bring in someone else from the group and they can better
Mm-hmm.
address that because that's something that they've experienced. So I just believe that, like I said, I love getting into the community. They often do feel comfortable talking to me and asking me questions. And like you said, when they feel hopeless, when they feel alone, oftentimes, we do have to consider suicide. Do they have suicidal thoughts? Do they have access to guns, or do they have a plan? So,
Right.
that's the whole, different assessment. And those are things that we have to, as providers, we have to address, we have to look for, and we kind of have to
Right.
dig.
Mm-hmm.
Sometimes the information is not just given to us laid out. We're like,
Right.
oh, this person is at risk for suicide. We kind of have to dig a little bit, but that it's just so important because, and this doesn't just affect adults, it affects
Right.
senior citizens, it affects teenagers, it affects young people. So that always just breaks my heart because, like I said, if they had someone that was just able to do a little bit of digging, maybe they could have gotten some help. The attempts are sad, but the ones that are successful with committing the act, it is always heartbreaking.
Right. Right. So, what are some things that people can do just in general, even if they're not in crisis mode or if they're not necessarily in, a place where they're feeling off balance mentally? What are some things that they can do just to improve their overall well being, just to kind of
Mhm.
help keep them kind of leveled out?
So I am a huge advocate of self-care. I am a component of self-care. I actually, one of the presentations that I do within the community is on self-care. Oftentimes we take great care of other people. We cook and we clean, we do everything for others. When it comes to ourselves, I'm tired. Oh,
Mm-hmm.
I don't feel like it. We've got to be selfish. Or as I say, self-care is actually not selfish. But
Right.
we've got to do those things, whether it's prayer or meditation, whether it's journaling, whether it's exercise, practicing a healthy diet. We've got to find our happy place, find out what makes us feel better about ourselves, whether it's a facial or a makeover, or getting your hair done. I encourage people going out with friends, go
Mm-hmm.
take that weekend trip to the beach. Find something that allows you to dedicate time to search yourself, to search your soul, and to just find that peace and to find that clarity. Because that's not going to just help, again, your mental health and well being. It's going to also promote physical, it's going to decrease anxiety, it's going to decrease stress, and that's going to help you physically, emotionally, mentally, socially, in every way.
Yes. I like that. And I tell people make it a lifestyle. You don't have to wait until your battery is completely drained. So I'm not here to say that life doesn't happen. But I like the self-care and just make it like a lifestyle of what, like you said, whatever it is that makes you happy or keeps you grounded. Just make sure you make it a routine. And I have to put stuff on my calendar a lot of times to schedule that because I've noticed that I'll keep going and going and going. And I'm like, wait a minute, I
Mm-hmm.
haven't done this in a while,
Right.
or it's been a year, you know what I mean? Uh,
Exactly.
so
Yeah.
it's not selfish. And I think a lot of people feel bad for doing those kinds of things for themselves. And I wonder, have you had anybody to tell you why they feel bad for doing some of those things for themselves?
So what I found when I do this presentation, they hearing like, yeah, I do need to think about myself more. I do need to, I think that, people realize that the times when I find that people do feel guilty about it is when we have caregivers that are caring for someone with some form of dementia, whether it's a vascular dementia or Alzheimer's. Those wives are wanting to care for their husband, they will not even go to Walmart. They will not go to church. They're in the house 24/7, caring for that loved one with dementia. They are the ones that typically I found will have a lot of guilt. So for them, I love to utilize the support groups, whether it's even online. Like if you can just get on your Facebook group or your church group, and sometimes that's a call. I've talked to patients like, oh, we do a weekly call, a prayer call. I've talked to patients, it was like, hey, once a month we meet at Panera. Whatever you can do to, I like to ask them, can you get your son? Can you get your daughter? Can you get someone to come and sit with your loved one for an hour to give you a break and get out? But usually in other times, people are like, oh yeah, let me go and get my nails done. I deserve it, right? So,
Right.
yeah, but I love to remind people to take care of yourself. It's like they say when you get on the plane and they give you the whole spiel before you take off, and they say put on your oxygen mask before you try to help someone else put on their oxygen mask. And it's the
Right.
same thing. It's the perfect example. You can't effectively take care of others if you're not taking care of yourself.
Right. Absolutely. So, from your perspective, you kind of touched on it already. How can families support not just a caregiver, but someone who's having a mental health challenge? A lot of people will say, "Well, I don't know what to do, what to say." And many times they don't. So, what are some things that they can do to help support that person? And I know that no two situations are the same, but how can they support them? You can talk about the caregiver perspective, and if the family member doesn't have like Alzheimer's or something like that, how can they support them?
So you want to reach out and you want to check on them regularly. And that may be just saying, hey, when is your next doctor's appointment?
Mm-hmm.
I'd love to go with you. I'd love to go with you to your next appointment. Hey, I understand that you may be seeing a therapist. Would you like for me to attend your therapy session? Hey, you're a part of this support group. So I believe that it is just checking on them, encouraging them, because of course we can't force them. And if
Right.
we try to push too hard, it actually just has the adverse effects. But if you can
Right.
encourage them to just have a healthy lifestyle, encourage them to eat healthy, because if they're taking in fruits and vegetables, they're going to feel better. And
Mm-hmm.
it's going to help their body digest. It's going to help their digestion. And that's probably a whole different segment, but that's going to help them feel better. It may be exercise, those
Mm-hmm.
endorphins. And I also like to tell people too, if they do have negative or poor habits, if they drink alcohol, of course, we know that alcohol heightens depression symptoms. It multiplies at times 10. So, of course, if we do feel like our loved one is struggling, in addition to encouraging those healthy lifestyles, let's kind of discourage them and kind of help motivate them away from drinking alcohol. That may be through an AA meeting. So I think it's just important to utilize those resources. Like you said, you've got to cater to that individual. So yeah, you got to it takes time. You've got to be patient, because you got to figure out what they're willing to accept and what they
Right.
absolutely refuse to accept.
Right.
But
Right.
that was a great question. Yeah.
And I always like to tell patients, don't fight them and beat them down and make them
Mhm.
feel worse. Like asking questions. And I know depending on the personality of the people, some people are like, well, you don't know such and such. You can't talk to them nicely. So you get a lot of that. And it's like, well, sometimes they may not give you the response that you feel like they should give you, but they're listening. You know what I
Absolutely.
mean? Like they feel
Absolutely.
like you care enough to ask, so at least they know that. Or well, it depends. Some may say, well, you're just being nosy. But you may have to say, hey, I'm asking because I care. Like you may have to
Mhm.
specifically say, the only reason I'm asking is not to get in your business.
Mhm.
If it's an adult, you can say, I know you're grown, you may not need me, but I'm just seeing some things. Where can I help? And if they
Yep.
say, well, oh, I'm fine, you may have to give them examples. Like you said, do you want me to go with you to that appointment? Or do you want me to just drive you to the appointment? Because they may say, well,
Mhm.
you can drive me there, but I don't want you in my session.
Mhm.
But at some point,
Absolutely.
they may decide, well, you know what? They are really taking the time to go with me and their concern.
Mhm.
Well, maybe I will at least let them go in the triage, and then they can go back to the waiting room. And then they may eventually let you go to the back, you know?
Absolutely.
So I feel like planting those seeds of letting people know you care, they are not in
Mhm.
vain, even if you feel like the person
Mhm.
is very resistant, for
I
lack of a
love it.
better.
Yes, definitely. Definitely. I love what you said about planting the seed because, you plant the seed. You can't just leave the seed after you
Yes.
plant it. You got to water it. You still got to care for it. And like you said, it's over time. It's going to take time. It's not going to happen overnight. So, yeah, it's about if you love someone, though, you're willing to put in the work, you're willing to put in the time.
Right.
So, yeah.
Right. So tell me about, a lot of people are seeing more nurse practitioners in the not just the family medicine space, but the mental health space. So how are you all able to help fill in that gap for mental health access?
So, definitely with nurse practitioners, it varies. We have what we're able to do and our standards of care, and the autonomy that we have is state per state. Sometimes, like in the state of Alabama, we do have to work with the physician. We have to have a collaborator. In several states, nurse practitioners are able to work independently. So we definitely, even with nurse practitioners being on board, sometimes there are still gaps, but as providers, nurse practitioners, PAs, I think when you talked about filling in those gaps, I think again it's good to just have a relationship with the patient, and I allow them, I don't set goals for them. I like to be very inclusive, and I like to ask the patient, hey, what are your goals? What are your, if I'm working with a mental health patient, what are your mental health goals? Or what are your, so when they are setting their own goals, and oftentimes they're great goals, like my daughter is getting married in a year, I want to lose 20 pounds. That's a great goal. So I
Mm-hmm.
want to try to help them reach that goal. And I have learned again to really utilize a lot of apps in order to help encourage them to stay on track, calendars, reminders. And that's what I love about smartphones, is that it makes it so much easier to do those type things, to fill in those gaps. And again, I also will tell my patients, start with your insurance provider. They have lots of rewards programs for smoking cessation. They're giving out money, they're giving out gift cards
Mm-hmm.
for weight loss. They're paying for the therapy, they're paying for the gym memberships.
Right. Yes. Yes.
They're
Lots of
going to
fun.
help you. Yeah, if you call and say, hey, I don't have access. We don't have a grocery store. I need access to some healthy foods and fruits and vegetables. They're going to connect you and send you information with local food banks to help you get those healthy fruits and vegetables. Insurance companies, they want you to be healthy, just like you want to be healthy.
Right.
You don't want to go into the hospital. They want to keep you healthy. They want to keep you out of the hospital. So
Right.
you both kind of benefit from those resources. So that is how I best fill in the gaps. You tell a lot of times the insurance company, they'll pay for you to get a Fitbit or some type of pedometer.
Mm-hmm.
You don't have to pay anything. So why not utilize that? Why not take
Right.
advantage of it?
For sure, for sure. So, as we kind of come to a close, tell us about renewed focus and the services that you offer, because you are helping to fill in the gap that way as well through that program. So, tell us a little bit about that and what people can kind of expect with that.
It's renewed focus. It's my baby. And it is just my way of being able to do both. It's being able to maintain my clinical practice and what I do and working with my patients, as well as being able to educate. So it is about educating, inspiring, promoting healthy lifestyles, holistic health and wellness within our local community. So a lot of times that's partnering with, I've been to schools, sometimes that's partnering with churches, and I'm able to speak to, of course, mental health diseases and disorders, as well as somatic and physical chronic illnesses such as hypertension. So usually if someone will give me a topic, a lot of times it's been for youth groups, it's been for women's groups. I've spoken on human trafficking, sexual assault. I've spoken on so many various topics that someone will say, hey, can you come and talk to us about self-care?
Right,
And
right.
so that is my way to really give back and to really just kind of develop those relationships. Also, it helps me to be a mentor. It helps me to just kind of get out there and hopefully encourage healthy lifestyles and healthy behaviors in my own way. So.
Okay. Well, awesome. So I always like to ask a guest, what is your advice for our audience on building a healthy family legacy? And whatever your take on that is completely fine. It's up to you.
Well, thank you. Thank you. So, building a healthy family legacy, I think that's about having a really strong foundation, a foundation
Hmm.
of love and support and faith
Right.
and unity. And so I believe when you take those aspects and you're able to instill them in each generation, so you're putting it in your children and they're putting it in their children, I think that is what it's all about. As the saying goes, each one teach one. So I
Yes.
feel like as far as families, and it doesn't have to just be, it could be a church family, it could
Hmm.
be your actual family, but it's about instilling those characteristics that you find most important and teaching them to continue to share the love and
All right. So, if people want to reach out to you and find out more about Renewed Focus and the services that you offer, how are they able to get in touch with you?
so absolutely I am on LinkedIn. You can find me on LinkedIn under my name, which is Jimel Gibbs, or you can find me under Renewed Focus Consulting. Also, I'm on Instagram, Renewed Focus LLC. And if you look at my bio information, it does give you my email address and my contact information.
All right. And we'll have all of that information in our show notes. It will be really convenient for people to just click and find, and they can reach out to you. All
Absolutely.
right. So thank you for sharing all of your expertise with us. This has been another wonderful episode of Voices for a Healthy Legacy. I am your host, Dr. Andrea, a board certified family medicine physician, and we are so happy that we had our guest today, Dr. Jimel Gibbs, and we will see you next time. Bye bye.